Yes, for therapeutic applications, as we say that these tetracyclines, they are broad spectrum. So they are used in treatment and prevention of different diseases. So one, they can be used in treatment of brucellosis, acne, the traveler's diarrhea, chlamydia infection, rickettsia, mycoplasma infections, cholera. They can also be used in gonorrhea, atypical pneumonia. And some protozoa infections. So many diseases, so they are broad spectrum. Now when it comes to, that's the therapeutic application. Now ADRs, all are adverse drug reactions. So some tetracyclines, for example minocycline, can cross the blood-brain barrier. It is very potent, so it carries the vestibular toxicity. Here you can have the vertigo, you may have the dizziness and nausea. Then there is gait disturbances, cause diarrhea, vomiting, nausea. Then some tetracyclines, for example, the dimethylcycline, they accumulate in the tissues. Then when you're exposed to sunlight, you can have the photosensitivity. So you can have the erythema, dimethylcycline. Then we saw the formation of the anhydrotetracycline, which is nephrotoxic. So those tetracyclines which have the OH group at position 6 can have the nephrotoxicity. Due to AP and hydrotetracycline. These tetracyclines, they have poor kidney excretion. So most of them they are retained in blood for a long time. So we can have azotemia. This chelation, we saw that chelation, so we can have the tooth decolorization. Also the bone deformities. For those kids or children below the 8 years, when their bones are still growing. So you can have the super infections. These are fungal infections. Since these tetracyclines are broad spectrum, they lead to the destruction of the normal flora, which can lead to super infections. have the hepatotoxicity. Now, when it comes to contraindications, we have seen the ADRs. Now we have, so this one was therapeutic indications. Now, contraindications. Of course, the lactating mothers is contraindicated in lactating mothers because of the chelation. So the tetracycline will chelate with the calcium, magnesium in milk. So for this lactating mother, it's contraindicated. Then the pregnancy or the pregnant mothers, so they can cause the placenta and they can go to the fetus. Then in children below 8 years, these drugs are contraindicated due to the tooth decolorization and the bone deformities. So those are the main contraindications for these drugs. Also, exposure to sunlight. If you take these drugs, mainly for the dimethylcycline, those ones which have the chlorine at position 7, so can have the photosensitivity, so should not be exposed to sunshine. Also, they are contraindicated in case you're taking the anti-anemic drugs. Anti-anemics, they are contraindicated for those ones who are taking the antacids. Shouldn't take those dairy products like milk because they can prevent their absorption. So those are some of the contraindications for tetracyclines. Now, when it comes to drug interactions, these tetracyclines, they have antagonistic effect with the penicillins. Remember, penicillins cell wall synthesis inhibitors. So that process needs the microorganism to be active. So in case the microorganism is inactivated, so there is no cell wall synthesis, meaning that penicillins will not work. Remember, these tetracyclines, they are bacteriostatic. So bacteriostatic leading to the inactivation of the microorganism, even the cell wall won't be formed. So penicillins, they have no use there. Then also warfarin. Warfarin is an anticoagulant. So these tetracyclines, they can inhibit the absorption of the vitamin K or those microorganisms in the GI responsible for the vitamin K synthesis. So they will worsen the bleeding. Drugs like tretinoin, this one is used to treat aching, so they will worsen the intracranial pressure with tetracyclines. Then we have cholestyramine. This is the bile acids cholesterant. So it will bind with the tetracyclines, prevent its absorption. So those are some of the drug interactions. Now, when you go to specific agents now, let's see them in the next video.